If you trim your toenails too short, particularly on the sides of your big toes, you may set the stage for an ingrown toenail. Like many people, when you trim your toenails, you may taper the corners so that the nail curves with the shape of your toe. But this technique may encourage your toenail to grow into the skin of your toe. The sides of the nail curl down and dig into your skin. An ingrown toenail may also happen if you wear shoes that are too tight or too short. How common? Ingrown toenails are a common foot condition, particularly among teenagers. Around 20% of people experience an ingrown toenail at some point in their lives. 2 out of 10 people who see their healthcare provider for a foot problem have an ingrown toenail. Symptoms. When you first have an ingrown toenail, it may be hard, swollen and tender. Later, it may get red and infected, and feel very sore. Any of your toenails can become ingrown, but the problem more often affects the big toe. An ingrown nail occurs when the skin on one or both sides of a nail grows over the edges of the nail, or when the nail itself grows into the skin. Redness, pain, and swelling at the corner of the nail may result and infection may soon follow. Sometimes a small amount of pus can be seen draining from the area. Ingrown nails may develop for many reasons. Some cases are congenital, the nail is just too large for the toe. Trauma, such as stubbing the toe or having the toe stepped on, may also cause an ingrown nail. However, the most common cause is tight shoe wear or improper grooming and trimming of the nail. Treatments. There are many treatments for ingrown toenails, ranging from home remedies to surgery. In most cases, you can treat an ingrown toenail at home with over-the-counter medication or home remedies. However, if the nail is infected or causing severe pain, you may need to see a doctor for treatment. Nonsurgical treatments. Ingrown toenails should be treated as soon as they are recognized. If they are recognized early, before infection sets in, home care may prevent the need for further treatment. Soak the foot in warm water 3 to 4 times daily. Keep the foot dry during the rest of the day. Wear comfortable shoes with adequate room for the toes. Consider wearing sandals until the condition clears up. Put some antibiotic cream to your toe and wrap it up in a bandage. You may take ibuprofen or acetaminophen for pain relief. When to see a doctor. If home remedies don't help in 2 to 3 days, you shouldn't try to remove an ingrown nail at home. Let your doctor look at it. If you have diabetes, there's a higher chance an infected nail won't heal properly. Sometimes an ingrown nail is caused by a fungus. A doctor can find out if you have a fungus and then offer treatment options. Surgical treatments. If excessive inflammation, swelling, pain and discharge are present, the toenail is probably infected and should be treated by a physician. You may need to take oral antibiotics or painkillers. The doctor may gently lift the edge of the ingrown toenail from its embedded position and insert some cotton or wax dental floss between the nail and your skin. Change this packing every day. The doctor may surgically remove a portion of the nail, a portion of the underlying nail bed, some of the adjacent soft tissues and even a part of the growth center. Surgery is effective in eliminating the nail edge from growing inward and cutting into the fleshy folds as the toenail grows forward. Permanent removal of the nail may be advised for children with chronic, recurrent infected ingrown toenails. If you are in a lot of pain or the infection keeps coming back, your doctor may remove part of your ingrown toenail, partial nail avulsion. Your toe is injected with an anesthetic and your doctor uses scissors to cut away the ingrown part of the toenail, taking care not to disturb the nail bed. An exposed nail bed may be very painful. Removing your whole ingrown toenail, complete nail plate avulsion, increases the likelihood your toenail will come back deformed. It may take 3 to 4 months for your nail to regrow. Risk factors. Unless the problem is congenital, the best way to prevent ingrown toenails is to protect the feet from trauma and to wear shoes and socks with adequate room for the toes. Nails should be cut straight across with a clean, sharp nail trimmer without tapering or rounding the corners. Trim the nails no shorter than the edge of the toe. Keep the feet clean and dry at all times. If your job increases your risk of toenail injury, Wear protective foot gear. Conclusion. Most ingrown toenails aren't serious. They should improve within a week or so without causing permanent damage with the proper home care. Most ingrown nail problems can be prevented with proper grooming of the toes and by wearing better fitting shoes. See your doctor if condition is not improving or serious.